Hey guys, Dr. Bergmann here at Rosemary Jones Chiropractic. This week's video we're going to be talking about something that's kind of unique to our office, and that's spinal decompression. So first we're going to show what it looks like on the models here so we can have an understanding of what decompression is, and then we're going to go out into one of our treatment bays where the decompression table is located and show you what it looks like when there's actually a patient on the table. So first we'll look at the models here, and if you recall back to our first video, we've got a disc, a nice healthy disc here, vertebra, disc, vertebra, and then there's alternating segments all the way down through the spine. So if we take a bird's eye view of the disc, there's a soft gelatinous nucleus on the inside surrounded by a thicker ligament on the outside. So when we get a disc bulge or disc herniation, this soft jelly nucleus in the middle starts to tear through this outer ring and push more towards the outside, and that's what creates the bulge or the herniation there. So this outside thicker ring is made up of rings of ligaments, like trunks on rings on a tree. So as that starts to tear through these, it starts to push out and cause a bulge on the side. So if we look at a model here, that's what the bulge is going to start to look like. It actually pushes out into this canal where the nerve is, and that's what's going to put pressure on that nerve. Now in your body, that's what's going to create the weakness, numbness, tingling, whether it's in your arms, your legs, or anything, is when this nerve is affected. Now when we make the adjustment, when someone's laying face down and we make the adjustment, we're affecting these joints in the back of the spine. Whereas this disc is really its own separate joint in the front. Now the adjustments themselves can be effective in treating this disc, but when we put you on decompression, what we're trying to do is stretch and space these vertebrae apart, and it essentially creates a negative pressure so this jelly nucleus on the inside can start to pull back towards the middle where we want it to be. So it's a very effective way to treat this disc itself, as opposed to just treating the joints in the back with the adjustment. So if we take a look at our spine here, we can see all these discs together in a row with the vertebra in between. So what we're doing is when we get you on the decompression table and we start to decompress the spine, what happens is these two vertebrae start to move apart. And since this disc is connected to those vertebrae, when it starts to stretch, it draws more fluids and liquids back into the discs and draws that nucleus back closer to the center. So it's a very, very effective, non-invasive way to treat the disc in the spine, whether it's in the lumbar spine, or if we look up higher here in the cervical spine, we can also do cervical decompression in our office as well. So now that we have a better idea of what's going on with the vertebra and the discs there, we'll go out to the treatment bay now and show you what it actually looks like on on a real patient. So I've got my patient here all set up on the lumbar decompression. So there's a strap that goes around the bottom half of the body, and there's a strap that goes around the top half of the body. So when I turn the machine on and it starts to spread apart, it's going to pull the legs in one direction and hold the upper body still. So when I start the machine, we're going to, you can hear it running, it's going to start to space that out. Now I can change the angle of his legs, so the shallower the angle, the more it's going to affect the lower disc, L4, L5. The higher I bring it up, the more it's going to affect the discs more in the middle, L2, L3, and we can go all the way up here where it's going to affect more L1, T12. So as the table spreads apart here, that's what's creating that tension in the disc and drawing that fluid back in there. So this is what lumbar decompression looks like. It's pretty comfortable for the patient. A lot of times we have people fall asleep on it, but again, this is what's going to be the treatment for the disc, as opposed to our chiropractic adjustment that's helping the joints. This treatment is what's going to help the disc. So in this case, we would put someone on this if they were having the sciatic pain, weakness, numbness, tingling down into the legs. So this is what lumbar decompression looks like. So now I've got the same table set up for cervical decompression. So what we've got here is there's two real soft rubber prongs here that the patient's head is going to come in and rest right on the back of these rests here. Now when the table turns on, it's going to slowly traction and pull the head up this way, or decompress the neck this way. So I'll have my patient lay back here. So his head's resting gently behind there. Now there's just one strap that goes up and comes onto the top of the head, and this just allows for the machine to create the pull there. Now when I turn the table on this time, this piece is just going to slide up and down in these tracks here. So it's going to create a very gentle pull on the discs. Again, it's very comfortable like it is in the lumbar spine, and it's going to help draw that disc back in towards the middle. So in the cervical spine, a lot of times people will have weakness, numbness, tingling in the arms, in the fingers, all the way down there. So when people are having those symptoms, when we hear weak, numb, tingling, those to us are nerve descriptor words, where there's something irritating the nerve. So that's where we would decide, along with our examination, whether someone needs to go on the decompression or not. So whether you need it in the lumbar spine or cervical spine, this is a very effective, non-invasive way to treat a disc issue without having to do any type of surgery or anything like that. So these tables are unique in our office, and they're a very effective way to treat that disc. So if you have, or if anybody you know has any weakness, numbness, or tingling, whether it's in the lower legs or in the arms, this is a great way here at the office that we can treat that, and it's a very effective method to do that. So if you know of anybody, certainly have them give us a call, and we would love to help them out. Again, I'm Dr. Dave Bergmann here at Rosemary Jones Chiropractic.